Greetings, Dr. Abimbola patients. Folorunso, I'm a resident doctor here in Ivano-Frankivsk National Medical University. I'm a Nigerian, and I will be talking about, first I want to thank Texila American University for giving me this opportunity. Thank you so much. I will be talking about improving maternal health, maternal morbidity and mortality in developed countries. This is a topic that I'm so passionate about, considering the fact that I'm from Africa, and women, we take part in large population. We account for more than half of the population in anywhere in the world. So I believe we should be taken care of, and the maternal health should improve. So this I will be focusing mainly on Nigeria, because I'm from Nigeria. The present statistics of maternal morbidity and mortality are unacceptably high in developing countries, and all hands have to be on deck to ensure that these preventable deaths are brought to earth. Globally, maternal mortality rate has fallen by 45% between 1990 and 2013. That is the global estimation. Sub-Saharan Africa accounts for 62% of deaths, followed by Southern Asia with 24% of deaths, and that's like 86% of all maternal deaths in the world. 1/3 of all global maternal deaths are in India at 17% and Nigeria at 14%, considering the fact that India is lightly populated and Nigeria is also lightly populated. From medical perspective, women die from complications that happen during and following pregnancy and childbirth. Globally, the rate of mortality is 1 in 90 childbirths. In developed countries is 1 in 3,700. I want you to take note of this. These figures. In developing countries, it is 1 in 52 births. In sub-Saharan Africa, it is 1 in 38. In Chad, it is 1 in 15, and in Somalia, it is 1 in 18. So you can see the rate is poor in developing countries and in sub-Saharan Africa. The burden of maternal mortality: 287,000 maternal deaths occur globally. India contributes to 50,000, so they are ranked first, and Nigeria contributes to 40,000 deaths, that is like 14%, and we are ranked second. 110 Nigerian women die daily. That is not acceptable. It is really, really poor for 110 women to be dying daily. You can just imagine that and estimate that in a year. It's really huge number of deaths, maternal deaths, not to talk of other deaths occurring in other departments or in other aspects, and 5 deaths per hour from pregnancy-related causes. And like I said earlier, according to WHO in 2012, Nigeria accounts for 14% of the world's maternal death, while we represent only 2% of the world's population. And most of these deaths are preventable. What the major causes? There are some things that leads to the death of this women, and we call them the 4 delay model. First of all, is the delay in recognizing danger or need to seek care, which is due to ignorance. Some women they are not educated. They don't know that they are not knowledgeable of the fact that they should take care of themselves, or the fact that they need to seek care. Most women, women, not until recent, we are meant to believe that we are subordinate. We are supposed to look up to the men to take care of us. So they cannot make decisions by themselves. And most women, they are independent. They depend on their spouses to take care of them, so they can't make decisions by themselves. And because even the spouse or the person to decide for them, it does not have the knowledge that this woman should go for to seek care, as a result of that, the woman could die. And low level of awareness, probably they live in rural areas where they don't even have, there is no electricity, no TV, nobody is going there to educate them on the need for a woman to seek antenatal care anytime she's pregnant. The delay in deciding to seek care, okay, maybe they've recognized the danger, but now they have to decide to seek care. Okay, low status of women, like I said earlier, some women, or even up to now, some women can't make decisions by themselves. They have to, there's a voice that speaks for them, there's someone that speaks for them, like a spouse or an elderly person. They have to decide for the woman. Or poor understanding of complications and risk factor in pregnancy and want to seek medical help. Some don't have the understanding of complications that could arise as a result of being pregnant. They don't have the knowledge about it, so that is one delay method. Previous poor experience of healthcare. Maybe they visited health center or hospital or clinic and they were poorly treated. Because of that, they won't want to go again for any second attempt. And financial implications, maybe poverty. They don't have the money to even take care of themselves. Even the spouse does not have money to take care of her. Maybe she's not even the only wife in the house, so the man will rather use the money to do something more important rather than take care of her. Another delay method is the delay in reaching care can also be due to the distance to health centers and hospitals. Or maybe they live in rural areas, the hospital is in the urban area, the distance is much, they cannot get there on time, or there's no money, availability of and the cost of transportation, no money to transport them, to pay for transport fare to get them to the hospital. Poor roads and infrastructure, maybe the roads are bad. Like in Nigeria, there are so many bad roads, even in the city, and now we are even talking about the rural areas. No roads, some places there are no roads that are accessible for them to even get out and go to the hospital. And geography, some people live in mountainous areas, some they have to cross different kinds of rivers to even get to the hospital. So when they think about that, they rather just stay at home and just look up to fate. There are another delay in receiving care. Okay, now they've gotten to the health care, but poor facilities and lack of medical supplies. This is one of the major problems we have in Nigeria today. The poor facilities, there are no medicines, no supply of medical equipment, there's no electricity. I worked in Nigeria last year. Even during cesarean session, sometimes they have to bring out flashlight to perform cesarean session, flashlight to perform to carry out deliveries. These are not good enough for hospitals. There are no lights, no good running, no good supply of water. These are the major things that are needed in the hospital. And these
Hello, patients. Just speak softly. Speak softly and stay away from my mic, please.
Okay, sorry. Can you hear me now?
Yeah, we are hearing.
Okay. The poor facilities and lack of medical supplies. There are no supplies to help in taking care of the woman even when they eventually get to the hospital. Inadequate trained and poorly motivated medical staff. Some staff are they are not well trained. Some they even have bad attitude. Like I said previously, some they just treat the patients anyhow. They lack good training and inadequate referral system. When they get to the hospital, sometimes the clinic might not have adequate system to take care of the patient, and they are meant to refer them to a better hospital. But if they don't have good referral system, this can also lead to the death of the woman. and these are methodology, review of literature, expert opinions, and these are my references. I had to contact some doctors in Nigeria to for my research as well. And in the United States, 91% of women are attended by obstetricians or family physicians at the time of delivery, while 9% are attended by midwives, and less than 1% of women in the United States deliver without the help of a trained health provider. You can see 91% of women are attended by obstetricians. They take care of their people. There are doctors to attend to women at the time of delivery, and that is why many people in developing countries, in Nigeria for example, they don't want to give birth in Nigeria, so the rich that have the money, they rather fly abroad when they're about to deliver to have their babies, either in the United States, in Europe, or any good hospital abroad that can take care of them. But many developing countries, there is an extreme shortage of doctors such as obstetricians and nurses to provide most of the health care. So most doctors now are leaving Nigeria, for example, for better opportunities abroad, because they take care of doctors very well. They have good facilities to work with, and many trained and good doctors in Nigeria will rather leave to a better. Hello.
12 minutes. You can conclude in 3 minutes. Yeah. 3 minutes.
Okay.
Please conclude.
Okay, yeah, I'm almost done. And this is the trend. I'm sorry, this table is not clear. It's showing the causes of maternal mortality in Nigerian hospitals, in UCH, in Calabar, in Kaduna, and in different hospitals in Nigeria. And in conclusion, in Nigeria, according to UNICEF, a woman dies every 10 minutes due to pregnancy complications and childbirth. That is about 144 women in a day and about 50,000 women in a year. That is so much. Only 42% of births are attended to by skilled medical practitioners. 42%. And I said previously, like 91% of women are attended to in the United States. Every pregnant woman should know and be able to recognize possible danger signs in an unborn child, and they should be able to seek qualified healthcare provider. And local interventions and global interventions, functioning health system, which is lacking strong country leadership. Our leaders, they don't take care of us. They only take care of themselves, and that has caused a ridiculous amount of death in Nigeria and in many African countries. Thank you.